Hello everyone, this is actually now part 2 of chapter 11's PowerPoint video. Sorry, I had a phone call I had to take and I don't want to have to go back. So, we're starting off around slide 13, ADHD. A lot of times, teachers don't get the understanding that a lot of the medication that can help those students with ADHD have a lot of side effects. And those side effects can be anger, can be abusive, can be sleepy. There's a lot of different things. And many times it takes more than 2 or 3 attempts to get the right. I had one student that I've worked with that almost seemed comatose at point. I mean, compared to what the student was when we had him, when this student was able to vocalize and was you know, you could see some laughter and I mean, generally good kid, but yes, he had ADHD and was hard to concentrate. And then all of a sudden they put him on some different medication, and I mean, it literally almost very concerned because of, I mean, it looked like he was overdosed. I mean, he just was not himself. And that's what I hear a lot of. The students that are on medication, they have the same, many of them have the same comments. They don't feel like they're themselves, and they don't like that feeling. And so, you know, it takes time. So don't automatically believe that the parents are several medication combinations, and the family has come to the decision the student's going to have to start trying to control, and you're going to have to work on the ABA and the self-regulation and self-monitoring, and not worry about trying to tell the parent they're wrong or thinking the parent's wrong. That's not right. Some of you may understand what I'm talking about. So anyway, there's my thing on medication and treatment. It might be congenital abnormality like a club foot or absence of a limb, etc. It could be impairments caused by disease, bone tuberculosis, impairments from other causes like cerebral palsy, fractures, burns, etc. And they all have the same thing in common. We've heard this before. Adversely affects educational performance. Strength, vitality, or alertness due to chronic or acute health problems. And they can be such as asthma, ADHD, diabetes, epilepsy, a heart condition, hemophilia, leukemia, sickle cell anemia, lead poisoning, nephritis, rheumatic fever, or Tourette syndrome. Adversely affects the educational performance again. Also, orthopedic impairment involves skeletal system. Neuromotor impairment involves the central nervous system. There's chronic testing and most often permanent. And then there are acute conditions of limited duration. Next one, I have a question for you, so I want you to kind of look at the question and then put me on pause. Why is the prevalence of chronic medical conditions in children much higher than the number of EA and orthopedic impairments and other impairments? Hopefully you've got this. I kind of touched on it already, but 2 factors. First, in order to qualify for special ed, a child's physical or health impairment must adversely affect his or her educational performance. So like I said earlier, they may have ADHD, but it really does not seem to be affecting their education in a bad way, you know, them into one of these disability categories because it's not adversely affecting educational performance. Many children have chronic conditions that do not adversely affect their educational performance. Additionally, many children with chronic physical or health impairments have multiple disabilities they're receiving under other categories. So we talked about that earlier too. They may have ADHD or they might be learning disabled. So all are there. The prevalence, talks about it here, around 59,000 children between 3 and 21 received services in orthopedic impairment. About 779,000 were served under OHI. And this represents approximately 1% and 12% of all students. And the actual number of children served is much higher than the number receiving special education because many children with OI and OHI receive service earlier, and some don't need those educational services. Why do you think attention deficit hyperactivity disorder is not included as a separate category? Well, in order to do that, a physician must determine a child has consistently displayed 6 or more symptoms Because the federal government has stipulated students with ADHD are eligible to under the other health impairments category, it's probably unnecessary. A substantial number of students diagnosed with ADHD receive it again under other categories as part of that also. Epilepsy is also one that can come under OHI because seizures are caused by abnormal electric discharges in the brain. There's tonic-clonic, absence, complex partial, and simple partial. Aura, which is a warning sensation that makes appears a short time before a seizure, and seizures can be controlled with medicine with up to 70% of the time. In this case here, a lot of times one of the main things I'll do is have teachers of our students that are under OHI because of seizures. They will go through some training. They'll go through some work with the nurse in your district that has a better understanding of what to do in case of seizures so that they are well prepared for those types of ordeals. And then I'll normally have them, when I was in the district, kind of make sure that each teacher knows what they need to do and who to call in those cases. A lot of times parents, again, are the best thing. They might be able to give you some ideas of why. Diabetes is also a chronic disorder that occurs when the body is unable to obtain and retain adequate energy from food. There's type 1 that have insufficient insulin, and there's type 2, which is the most common, results from insulin resistance. There's also asthma, most common lung disease of children. Prevalence ranges from 7% to 10% of school-age children. Leading causes of absenteeism in school. Causes are unknown but considered an interaction of heredity and environment. And emotional stress can also be a factor. Treatment involves an asthma teaching program. Sickle cell disease, Tay-Sachs disease, and cystic fibrosis is also in there. And then you also have HIV and AIDS are also in there for those areas there. Another question, how might the visibility of a physical disability or health impairment affect a child's self-perception, social development, and level of independence across the different environments? I'd like for you to pause the video and think about that and write this down on a piece of paper to see what your thoughts are. And then whenever you get it down, you can go ahead and continue. The answer, how children think about themselves and the degree to which others accept them are often affected by the visibility of their condition. Some children use a variety of orthopedic appliances that make their physical impairments more noticeable and make the child with disabilities look even more different than their classmates. The visibility of some disabilities may cause others to underestimate the conditions that are not as visible, like asthma. And it may decrease the inclination of others to provide the student what they need with that. Next one, cerebral palsy is the most prevalent physical disability in school-age children. There's no clear relationship between the degree of motor impairment and degree of intellectual impairment. And I want you to know, again, the ability levels of these students that are in the OHI category can vary, but many of these students can lead a good academic life and can go on to colleges and get a degree and do what they want to do. So don't look at them as a student with a disability that doesn't have the abilities, because they do. I do want you to watch this video on cerebral palsy. It is the most prevalent disability among school-age children. This is from London, but go ahead and pause my video and go ahead and listen to the cerebral palsy. Looks like from London. And we'll come back. So go ahead and put it on pause and go watch the video. All right, I hope you enjoyed that. A lot of times it was British. The way they sound just kind of makes it funny to watch, but they do have an awful lot of good points about cerebral palsy and that for you to know. Next one is spina bifida, congenital malformations in the brain or spinal cord or vertebrae. Most common neural tube defect can result in paralysis below affected vertebrae. There are 3 types. There is spina bifida occulta, which is the mildest one. There's micromeningocele. I always have fun saying that one. Most common and most severe form. And then the There's hydrocephalic condition common in many children. Can be treated with a shunt. Requires clean, intermittent catheterization during that time too. Then there's muscular dystrophy and spinal cord injuries, quadriplegic, paraplegic. There's also students with physical disabilities or health impairments function well below grade level academically. Some of the characteristics include genes and medications have negative side effects. The other part of this is because of their disability, because of needing to have healthcare routines, there's a lot of time outside the classroom seeing the nurse, to getting things done. Also, there's a lot more doctor's appointments maybe in some of these, so they'll miss classes because of those. So you do need to watch that. As a group, these students perform below average on measures of social behavioral skills also. The next one, variables. Physical disability or health impairment can limit a child's ability to engage in age-appropriate activities, mobility, cognitive functioning, social and emotional development also. Age of onset, children with congenital or acquired impairments have different needs. And the visibility of the impairment may cause some to underestimate these children. We talked about that earlier. A lot of these students in this area will have many other professionals that are working with him. And these are just a few on the next slide. Physical therapists, occupational therapists, speech and language pathologists, adaptive physical educators, recreational therapists, school nurses. And then you have others that they might see outside of the school environment too. The next slide, I want you to understand the difference between OT and a PT. OT and occupational therapists are concerned with things that promote self-help, employment, and communication, while as the physical therapists are involved in the development and maintenance of motor skills, movement, and posture of students with physical disabilities. And you want to make sure and know that. Educational approaches, it gives 3 in this slide here. Environmental modifications, assistive technology, low-tech and high-tech. I'd really like for you to look over that because in this world of technology, not everything is a high-dollar item. So I want you to look over that in the book, get an idea of what a low-tech and a high-tech and what the differences are. There's a hint that you'll want to know that. Animal assistants, you've got helper or service dogs. There's also monkeys as personal care attendants. I used to have a Blackboard assignment talking about some of this stuff too. So those are some of the ideas there. There's special care, healthcare routines, proper positioning and movement to encourage development of muscles. Proper seating helps combat poor circulation. And lifting and transferring requires making contact with a child in order to transfer them from one thing to another. There's also independence and self-esteem. And I think as much as it does pertain to this one, I think it can pertain to many of our students in special education. So really look at this and take it to heart so you can remember some of these things and go from there. They need encouragement to develop a positive, realistic view of themselves and their physical conditions, as much independence as possible, and the ability to cope with their disabilities, set realistic expectations, and accept help gracefully when needed. Collaboration with self-help groups for people with similar disabilities is also something that's very helpful. The next one is from a father's perspective about ADHD, and I think this will go right along with some of the ideas that I've already talked about, but it's very important that you get perspective from the father's perspective of ADD. So please pause and watch the video. All right. During the 2012 school year and 13 school year placement, 55% of students who receive special education services under OHI and 60% of those with OHI were educated in general education classrooms, while 22% and 16% were served in resource rooms, and 10% of those with OHI and 22% of those with orthopedic impairments were educated in a separate classroom. One last question. So of the many ways that physical environment, social environment, and instruction can be modified to support the inclusion of students with physical impairments, health impairments, and ADHD, which are most important? If you'll pause it and write down what you think would be the most important way that you could modify and support them. Okay, go to the next slide. Teachers of children with physical and health impairments often find it necessary to adapt equipment, schedules, or settings so their students can participate more fully in educational recreational activities. Although there is currently an increasing trend toward integrating children with physical and health conditions, this practice has raised several controversial issues. These issues revolve around determining the extent to which teachers and schools should realistically be expected to care for students with physical and health-related disabilities. Decisions concerning the safety of all students must be made. Perhaps the most important classroom modification is creating an atmosphere in which a student with a disability feels socially accepted and comfortable enough to learn and contribute. And this really does relate totally on the shoulders of the teacher of that student. To make it so they're socially accepted and comfortable, because they do set the tone for the classroom. And many times now, with the way we're working at trying to be including all students, especially in regular classes, you're going to see more and more students come into the regular classroom that maybe wouldn't have in the past. And then the last slide, related services in the classroom and inclusive attitudes. Controversial issues concern including students with physical impairments and social health care needs in the general ed curriculum. The extent to teachers and schools are responsible for the health care needs. If you listen and remember from the book, Irving Independent School District versus Tetro, catheterization is a related service, meaning that, yes, teachers, parents, and health professionals were required to help the student with catheterization. And then Cedar Rapids Community School District versus Garrett F. Nursing services are related services also. Acceptance is the most basic need of children with physical disabilities and health impairments. I wanted to continue and make sure that you understood that again also. Well, that is the end of Chapter 11, PowerPoint. What I need you to make sure is after you've read this in the chapter, complete your quiz and then study guide. And then work on finishing, after you get done with that, work on finishing the discussion board from the other chapter, Chapter 10, and on other assignments that are due this weekend. So anyway, have a great weekend, and that is all for Chapter 11.